Can I ask the other panelists to come up? We have about 10 minutes, I think, to have a brief conversation. And let me introduce Sally Oken from Patients Like Me, and maybe you can begin with short remarks, and if you don't mind giving us back a little of the time.
I don't mind at all. I appreciate being here and the opportunity to be able to address some of the things that came up this morning. I think we have some common themes. I'm from Patients Like Me, and for those of you who are unfamiliar with it, Patients Like Me is a research-based, clinically relevant site for patients, peer-to-peer relationships where they can establish profiles, provide health data into the system, share it amongst each other and amongst us as researchers, and then we make that data available in an aggregated way in ways that we de-identify it and then try to make some sense of it for people who might be interested in that. That's our business model. The site is free for patients. There's no advertising at all. So I was asked to give a little bit about what of the lessons that we've learned. We've been doing this for 7 years. I think we're innovators in really gathering patient-reported data. We are not doing clinical trials, so I want to say that quite clearly. However, we are doing research. So one of the things I want to start with is one of the mandates that we say to ourselves is when someone gives us something, we need to give them something back. So it's our give something, get something motto. And I think that that can be looked at in a variety of ways. One way is that when we've actually started downloading all the clinicaltrial.gov data every night, and every morning patients can go onto the site with one click, see the data that they've given us. We will then show them all of the trials that they're eligible for based on location, by age, by gender. So it helps to simplify the process. But if you think about it, if patients have given you data for a research project, then you should be giving that back to them in some fashion that's identifiable for them, that they can make some useful, meaningful use of in terms of their own life and decision making. The next is patients first. We feel very strongly that when we are engaging patients in a data sharing environment, that we need to put their interests first, and we need to understand that they have a lot more skin in this game than any of us in this room do. That they have about 90% of the time spending more of their time doing self-management of their care. So they are the experts in their condition. They have the expert knowledge and the expertise in managing it that as clinicians and as researchers we could just never have. We need to hear that. We need to listen to that. We need to collect it. We need to understand it. Then finally, listen well. I think this is probably one of the most important things to me. Patients have things to say, and frankly, they want to tell us stuff. We've recently participated in an IOM discussion paper on effective communication. It was just released about 2 weeks ago. And one of the questions in that we have actually expanded on and are now doing a full survey on was asking patients, how do they feel about the statement, my health data should be used to help improve the care of future patients who might have my same condition. Overwhelmingly, 89% of the people who were in that survey, there were over 1,000. It was a general population of patients, so it wasn't people in the population. It wasn't patient necessarily. 40% of them all reported at least one condition. 89% of them said, yes, I feel very strongly that my data should be shared for that purpose. Yet, when asked whether they thought it was being shared, the majority said they either didn't know or no. So we have a huge gap between what patients are telling us they want and what they perceive us to be doing. So finally, I think I want to make a couple of provocative statements, and I'm going to give you the time back. One is, when we listen to patients, we need to be recognizing that the data they're giving us is intimate data. It's data about their daily lives and the things that they're dealing with every day. They are not simply human subjects. They are participants who are actually members of the research team. I would change our paradigm completely and start thinking of patients as patient researchers or citizen researchers, however we want to call that. I would also say that we have to start capturing the patient vocabulary in ways that it's better understood by clinicians and researchers. We do that at Patients Like Me. Every piece of data that comes into me, we curate it, we keep the patient voice, and we curate that against a coded, clinically known terminology. So you'll hear the patient voice first, and then you have to look and see what the clinician result of that might look like. And then finally, I think we need to really recognize that when you empower patients and then you engage with them, they will activate if you give them the right tools to do it. And there's been a recent blog post that said if patient engagement is really the blockbuster drug of the century. And if that were the case, if it were a drug and we weren't using it, we would be considered practicing malpractice. We would be providing harm because we're not using it. So finally, The system's never going to be perfect, but I think we are at a place today where we're starting to talk concretely about all the stakeholders, and I'm going to just constantly bring us back to the fact that without patients, we would have no research. So let's start thinking about how we can best honor them, respect them, and allow them to develop the trust that they need to trust to participate with us to find the answers so that they and their clinicians can start solving the problems of their medical conditions. Thank you very much. You've got your time back.
Thank you so much.